Today we're at the Health and Spine Wellness Center in Belleville, New Jersey with Dr. Mike Chillemi. And thank you for being here with us.
Thank you for having me.
Thank you, Dr. C, as he's also known as.
Yes, easier, Dr. C. So you do so many different things here, so I really want to dive into all of them.
Absolutely. We look forward to it.
All right, so tell us how you got started.
I got started with chiropractic a long time ago. I have family members who got hurt and chiropractic brought them back. So from that, I kind of just jumped into the field really early on, even as early as my junior in high school. I knew where I was going.
Oh, wow.
And I set my path forward. Graduated really young because I had the goal of being a chiropractor. So
that's awesome.
I jumped right into it.
Knowing what you want to do in junior high school, that's pretty good.
Yes.
Yeah.
So it's so from there, I've been practicing now 25 years. Doing it a long time. Recently made a lot of changes in our office.
Okay. Tell us about those a little bit.
So the changes are, we went from a chiropractic and physical therapy practice to now an integrated medical practice.
Love that. That's the way everything's going these days, really.
So integrated for us means we have medical, we have physical therapy, we have chiropractic, massage, all working together for the common cause of treating the patient efficiently, effectively, and quickly, but getting tremendous results.
Love that.
So that's what we're here for. Okay, so the reason why I changed is I tore my ACL, MCL, and medial meniscus while I was skiing.
Wow.
It's called the unhappy triangle.
Sounds unhappy.
Truly unhappy.
Ooh. So
I went to see an orthopedic that I know. They wanted to do a complete knee reconstruction because that's how bad it was. I didn't want to do it. I'm at an age where I wanted to make sure I have my 50s, 60s, and 70s, and 80s tremendous with my own body parts. And once you get a cut, a surgery, you're never quite the same. So I didn't want to be that person. So I looked into different medicines, and regeneration medicine is what I found, and that's what I did.
So how are you today?
So today I'm fantastic. 40 minutes on the elliptical, squatting, doing anything I want to do, I could do. I did really well fast that I changed my whole office because nobody around here is doing it. And if I could help save somebody else's knee from surgery, knee, shoulder, hip, I want to do it. So I felt like there's a tremendous need in the community, and we were able to bring it now. And we've been doing it for over a year now, and getting a lot of patients doing fantastic and saving them from surgery, which is my ultimate goal. If I could save me, I'm selfish if I don't save others.
Right. No, that's fantastic.
So you're a total wellness center.
We absolutely, 100% total wellness.
Do you think you could actually prevent someone from having to have hip replacement, or at least?
Absolutely.
Really?
Absolutely. We have patients that are pretty much bone on bone, and we're able to give them joint space, cushion back into that joint where they can actually function again and avoid surgery.
Can you explain to the audience a little bit how that works?
So regeneration medicine is a medicine that we use buiologics and the body to help heal itself.
Okay.
So we have different products, whether it's human cellular tissue products, it could be Wharton's jelly product, or PRP, platelet-rich plasma, and a variety of other treatments and protocols to correlate to a tremendous result. Everything together. So it's not one of them. The formula we have and that we've working on perfecting is really what's catapulting patients to do really well in a short period of time. It's very rewarding when I see when a patient rings our bell. They ring a bell when they graduate. And
I love that.
It's very rewarding to see them do that, because that means you've changed their life now. It's not just a temporary change, it's a permanent change, and we see it on x-ray.
So tell us a little bit about what else you do here, because I know that that's your main focus right now.
Right, so I mean, we do chiropractic, physical therapy, massage. We also do vitamins, weight loss, vitamin injections, weight loss program. So we have a lot of natural healing type properties that we do in here.
What are some of the conditions that you would treat here when you see a lot of people coming in with?
So for regen medicine, our biggest conditions are knees, could be osteoarthritis, could be meniscal tears, could be ligamentous tears, hip pain, osteoarthritis in the hip, shoulder, labral tears. Anything with the joints, the extremities, works tremendous with regen.
That's great. And you can actually repair a tear? without having to have surgery?
It depends on how bad it
Right.
is. Yes.
That's incredible.
That is amazing.
Yes.
Yeah.
Yeah.
If it's a complete tear, no. Complete
I
tear,
understand.
Well, sure.
But if it's partially torn, then absolutely.
So after somebody has had surgery for a major tear, would it benefit them to then come here?
So absolutely we do this type of treatment after surgery. So we'll correlate with the orthopedic surgeon and see what exactly they're looking for. Usually it's about 6 weeks after the surgery, we can go in and do some of this regen medicine. And the regen actually makes the surgery even better. Because it's going to put, whether it's the human cellular tissue products or the PRP, and really get that joint stimulated to heal the proper way and not get laid down with any scar tissue or anything bad. It's going to kind of superfect that treatment.
Yeah.
And
yeah.
faster.
That's
Sounds like it would be so much
Absolutely.
faster and then just that much better.
Absolutely.
Yeah, I'm absolutely going to come here if I ever have to have surgery on anything.
Yes.
So strengthening some of these muscles here will correct some of this posture problem that you're having. Okay, so we're going to feel some clicks and pops in here. We're going to get that spine moving. Take a nice deep breath in, all the way out. Let your shoulders drop down. Good. One more time, deep breath in, all the way out. Let your shoulders relax. Good. Perfect. We'll do one more in here. Deep breath in, all the way out. Let your shoulders drop. Good. I'm going to have you lay on your right side facing me. We're going to go this, and again, I promise you're not going to fall. Good. Let's go on your back, looking up at the ceiling. Headaches? All right, so these are a little louder, and that's just because your ears are here. Promise it won't hurt. Good. Good. Come on.
Thank you.
So how can people get in touch with you?
Our website, healthspinewellness.com.
Wonderful. Well, I hope everybody comes in that, with all these joint
Yeah.
problems and gets in here quickly and lets you take care of them.
Absolutely.
Yeah, I have a list of people I'm going to send here.
Yes, absolutely. All right. Well, thanks again. And
you.
we'll be right back after this.